So sorry about that. Some of my neighbors were outside of my door, and Roxy was not having it. So anyway, we're talking about music medicine, and I was saying that one of the distinctions is by who is implementing it. Is it doctors and nurses? That's probably a clear indication that it's music medicine. But music medicine is the use of music as a complementary method for other medical procedures. Um, in the book, it talks about listening to music before having an operation to help reduce blood pressure and reduce anxiety. So it's used as stress management in surgeries or cancer treatments. It's helps with management of pain, anxiety, and blood pressure. And then also melodic intonation therapy. Remember, it talks about that in the text too, about speech pathology for people that have aphasia, stroke patients that have aphasia, that it can help rebuild language skills. And that's completely different from performing arts medicine, which the book does a really nice job of kind of talking about the main areas that people might go and see a specialist with a doctor that treats injuries or medical concerns of musicians specifically. In some ways, it's kind of like thinking about an athletic or a sports medicine doctor who deals with the same type of stress fractures or the same kind of injuries that they see over and over again. And performing arts medicine is treating the medical problems of performing artists. I think the book does a nice job of talking about the potential for hearing loss in our field, especially if you're a band teacher. If you don't already own um, some ear protection, you should definitely do that. And Yeah, I mean, I think it's one of those things we really take our hearing for granted, and there's research showing that teenagers today they already have blasted their ears with their um, iPods and phones that their earbuds that are in their ears. They say like a whole generation of people will never hear the sound of rain, um, rain pattering on the rooftop because that's like they've lost that sensitivity, which is really sad. Um, and so there are certain things that we can do to protect ourselves, including wearing ear protection in loud situations and to take breaks. So, um, if at the end of rehearsal, if you give your students 10 minutes to practice on their own, um, maybe you definitely take that time to, be in your office and where you can see the students, but you're a little away from the noise. But you also have to worry about the noise of your students too. Um, I mean, the hearing of your students as well. So, definitely design some breaks in the listening of the day. I mean, you are in that class period or in that classroom 5 or 6 hours a day listening to a lot of sound, where students might only be in there for 1 hour and they're probably okay. But those statistics for marching band and drum and bugle corps, I mean, those are crazy. And so those are definitely things that you should think about as far as because as music teachers, we like to think that our students they want to pursue this the rest of their lives, and if they are deaf by age 50, then we kind of have they've shot themselves in the foot. So we need to have discussions about um, protecting our hearing. Voice for choir people, especially, a lot of voice teachers or choir teachers develop vocal nodes or continual hoarseness of their voice, and so they may seek out treatments from specialists. At the University of Washington, one of the voice teachers, she was certified um, with rehabilitating voice students, so students that have vocal nodes or that sort of thing, and if they have some surgery to deal with it, she's a voice teacher that could help. I mean, these are singers of very high caliber. She is trained to help build the voice without doing any damage to the vocal mechanism. So, um, so that's another area of performing arts medicine. Um, Secondly, or thirdly, they talk about bodily injury, such as elbow or carpal tunnel. Um, they do a pretty good job just discussing that. I know that several of you are interested in that as far as your own research area, and I think I definitely think there's a lot for us to know because I'm in choir world, and so we don't talk about injuries that much. I definitely talk about overuse of the voice and vocal rest and those sorts of things, and kids don't really get it. Like I would say, well, if you can't, if you feel like your hoarseness is not going away or laryngitis isn't going away, you should not talk, you should not whisper, you should not, try to give them things to help repair the damage that they were doing to their voice, and they hadn't necessarily hear it. So it'd be, I think, for research, looking at especially bodily injuries from overplaying or incorrect technique, that sort of thing. I think a research area that we really could work on is what are we telling our kids? What do professors know about injuries and how to treat injuries and how to go about and help students not be injured, or if they are injured, how to give them the proper recourse so that they will be able to play healthfully. And then lastly, performing arts medicine, they also deal with psychosocial well-being, right? So I talked about anxiety and stress, and that a lot of people seek performing arts medicine specialists to deal with anxiety, all the different types of relaxation techniques, that sort of thing, or beta blockers. A lot of people use beta blockers. They feel like it doesn't affect their performance, but it's probably an individual thing. If you don't have that physiological arousal, then maybe it could, in some ways, affect the performance. And also, musicians tend to have more volatile relationships than the general population, and so some people seek performing arts medicine specialists to deal with their interpersonal relationships as well. I want to take just a few minutes to talk about and I think it's pretty straightforward, right? It's this Finland, looking at singers who, what are the perceptions of the benefits that they get from music, and is their quality of life truly better? And so their big finding is, yes, if people sing in choirs, then they have a better quality of life. They're generally happy. They're not depressed. That was a pretty interesting finding that they had. But one of the things that we need to remember in the study is that they are asking people, what effect does choir have? They pulled people that are already participating in choirs. And so there may be a bit of a Hawthorne effect here, where the participants are saying things that they think the researchers want to hear. I'm not saying it's, that this is not true, but one of the things that we have to remember is that these are people that want to be in a choir. Like, they have selected to be in a choir. So maybe their finding isn't that being in a choir gives you a better quality of life as you age. It could be when you are aging and you participate in a social activity that you enjoy doing, then you're going to have a higher quality of life. So maybe like going to the pub and hanging out with your friends while drinking a pint, maybe that has the same effect as singing in a choir. Or maybe, if you like square dancing, going to square dancing has the same effect as, being in a choir. It's just really hard to untangle a lot of these variables. And the methodology, only looks at people that are in choral ensembles that select to do that. Because some people, if you randomly assign them to be in a choir, they would have a lot of anxiety about that. And so they probably would not have the same quality of life outcomes. So, as with all the research that we read or think about or consider pursuing ourselves, we have to be really critical of it. And I think there are things to glean from this. I mean, there's statistical, like, you probably didn't follow all of the, they did an exploratory factor analysis, then a confirmatory factor analysis. You probably don't know what any of that is. And that's really complicated and complex statistical maneuvering to get to their findings. And so they feel confident about the things that they assess. But at the end of the day, they're still looking at people that like to be in choir, and they didn't compare it to a control group. It was really, there's a lot more they could do to really kind of tease out what the data they got, what it really means in comparisons to other studies. And like I said, I think like the Hawthorne effect, if you give them, and I don't know if it mentions the order of things that they had them take, but if they gave them the perceptions of benefits of a choir first, and then gave them the depression scale, and then gave them the quality of life outcomes after that, that's really problematic because it's priming them to think about, oh, what do you think you're going to get out of this this choral experience? Which there again, too, Finland is an interesting place because they have a very rich choral history, and it's very much woven into the fabric of their culture. If you did it here, some pockets of our culture, appreciate choral music, but it's not the same as it is in Finland. So they mentioned that generalizability is a bit of an issue. Anyway, so the thing I wanted to add about that comment about really looking at the study critically is there are a lot of studies that kind of come out and say, oh, if you are in this group, and for some reason it's always choir. If you're in a choir, you have these extra musical benefits such as lowered stress and feeling better about your family or things like that. And again, you have to look at the methodology, because if they did a random assignment, I don't think they would get the same results, because some people do not dig being in a choir. They find it highly stressful, and their stress would go up. So just be wary of that sort of thing. All right, I think that is all. We're a short week as the lecture goes. All right, so you're going to have until the end of spring break to finish this module. So those of you that get a spring break, I hope you have some time to enjoy and rest and aren't working all the time. But I know how it is, the life of a music teacher. So let me know if you have any questions about what's going on in the class. All right, thanks. Bye.